Did you know that restless leg syndrome affects about 10% of Americans, according to the National Institute of Neurological Disorders and Stroke? 80% of people with RLS have a related condition called periodic limb movement of sleep, PLMS. PLMS causes the legs to twitch or jerk during sleep. It can happen as often as every 15 to 40 seconds and can continue all night long. PLMS can also lead to sleep deprivation. Hello and welcome to another episode of Health Protocol. Today, we're talking about restless leg syndrome, RLS, also known as Willis-Ekbom syndrome. Its symptoms, how it's diagnosed, and potential treatments. It's a tricky condition, but it affects a lot of people. You have a strong, often irresistible urge to move the legs. This usually occurs with uncomfortable feelings in the legs. Your symptoms start or get worse when you're resting, such as sitting or lying down. Your symptoms are partially or temporarily relieved by activity, such as walking or stretching. Your symptoms are worse at night. Symptoms can't be explained solely by another medical or behavioral condition. Stick around, and if you have restless leg syndrome, please leave a comment. There are many of you out there, so share how much it bothers you and what's worked for you to help others. So, you're not just a doctor talking about it, but also a patient who had it. Definitely a patient. We've seen this before, where you liked it so much you bought the company. Yes, thankfully I'm mostly recovered. So, what exactly is restless leg syndrome? It's exactly like it sounds. An overwhelming, often uncomfortable urge to move your legs. People describe it in many ways, like skin crawling, or a sensation they can't quite put into words. It's actually a neurological disorder where your brain is telling your legs to move. Some theories suggest it might relate to anxiety or an old fight-or-flight response, but we don't fully understand it. And even those who have it don't completely grasp why it happens. This condition has been recognized for hundreds of years. While it's not one of the most commonly discussed medical conditions, it's surprisingly widespread, affecting 5% to 10% of the general population and up to 20% of pregnant women, possibly because iron is being shunted to the baby. RLS was first described in 1672 by Sir Thomas Willis. Not Different Strokes Willis, and not Bruce Willis. Sir Thomas Willis was a fascinating figure in early medicine, a time when much was still undiscovered, so he got credit for many things. You know what? I would have loved it. I would take anything. They'd be like Zal syndrome. I'll take like a pimple on the end of the nose. That's Paul's pimple. Or, if you have a pathologic intolerance for incompetence, that's Dr. Weaning syndrome. I feel like that could be Alzo syndrome as well. Willis was responsible for numerous discoveries. He was one of the first to formally write about type 2 diabetes and sweet urine diabetes, which was even called Willis disease back then. He also identified the arterial structure at the base of the brain, known as the Circle of Willis, which medical students still learn about. And he was the first to number the cranial nerves, the 12 pairs of nerves in your head, a system we still use today. He was friends with prominent figures of his time, like Isaac Newton. He even once, with a friend, supposedly revived a woman named Anne Green from death after she had been hanged, placed in a coffin, and then started coughing when they opened it. Not sure about the coffin origin story, but it makes for a good tale. The Ekbom in Willis-Ekbom syndrome refers to Carl Axel Ekbom, a Swedish neurologist who further described the symptoms and treatments of RLS much later, in 1945. He helped formalize the understanding of this disorder. It's still often underdiagnosed and not talked about enough, despite being quite common. The diagnostic criteria for RLS have been formalized by a dedicated group and include 5 key points. An overwhelming urge to move your legs. This is the core symptom. Symptoms come on or worsen when you are resting, typically as you're getting ready for bed or lying down. Symptoms are usually worse at night. It's rare for people to have RLS in the morning or during the day. Symptoms get better with movement. The symptoms cannot be explained by another medical or behavioral condition. For example, if restless legs are caused by poor circulation, bad veins, or another neurological disorder like Parkinson's disease, then it's not RLS. RLS is a syndrome, meaning it's a collection of symptoms grouped together because there's no single diagnostic test, no specific thing you can see under a microscope to confirm it. So, who should see a doctor? Many people with RLS manage it on their own. But if your symptoms become so severe that they disrupt your life, preventing sleep, affecting relationships, or impacting your job, then it's time to see a healthcare provider, typically your primary care doctor. However, many primary care doctors aren't very familiar with RLS, as it's not extensively taught in medical school. If your family doctor isn't sure, they might refer you to a sleep specialist, often an internal medicine subspecialty, or a neurologist, as it's considered a neurological disorder. Tests and associated conditions. While there's no definitive diagnostic test, some tests might point toward RLS. Low iron levels. This is more common than not in people with RLS, though we don't know exactly why. This is also why it's more prevalent in pregnant women, as iron is directed to the developing baby. An iron test is often a starting point, though it can be tricky to assess accurately. Sometimes, you can have low blood iron, but also lower brain iron. Iron should only be supplemented under a doctor's supervision due to potential consequences. Low magnesium. This has also been associated with RLS. Sleep study. You wouldn't usually order a sleep study just for RLS, but if you're already getting one for insomnia or suspected sleep apnea, it might reveal periodic limb movements, involuntary jerking, or twitching of the limbs during sleep. These often go hand in hand with RLS, but are not the same thing. Personally, I've had a sleep study. When I first got married, my wife would ask, "Are you on something?" Because I'd get up in the middle of the night, my legs so restless. I developed a habit of drinking chocolate milk, convinced it would help me sleep. But it was just a vicious cycle of anxiety about not sleeping. The sleep study confirmed I didn't have sleep apnea, which is important for overall health, especially heart health. But I did have a lot of periodic limb movements. My legs would be moving so much, kicking my wife, that the sheets would be on the floor by morning. My wife even went for a sleep study to see what was wrong with her, and they said she slept perfectly. It was all me. Despite the probes and strange room, I actually slept pretty well, except for my restless legs. Common treatments. Okay, before we reveal how Paul got rid of his RLS, let's talk about common treatments. No treatment is 100% effective, and individual responses vary. Iron supplementation. If you have low iron, treating it is a common first step, typically with oral supplements guided by a physician. If oral iron isn't enough, intravenous iron might be needed. Iron's role is thought to be linked to its effect on dopamine in the brain, as iron is involved in dopamine transport and receptor function. This connection is interesting because dopamine is also central to Parkinson's disease. Dopamine agonists, medications in the same class as Parkinson's drugs, like pramipexole, Mirapex, are used to treat RLS. For a while I was on pramipexole, It was brutal. You've got to get something for those legs. It worked pretty well for Paul, but he often forgot to take it an hour or hour and a half before bed. Doctors are the worst at compliance. One downside of these drugs is augmentation, where paradoxically, as the dose increases over time, symptoms can worsen. This is tricky because reducing the dose helps symptoms improve, but then you're back to where you started without medication. Gabapentin class medications. These target nerve pain and are sometimes used. Narcotics. Surprisingly, drugs like tramadol, oxycodone, and even methadone have historically been used. However, with the current opioid crisis and the risk of dependence and increasing dosage over time, these are now used as sparingly as possible. Good sleep hygiene. This is crucial. Exercise. There seems to be a U-shaped curve with exercise. Being very inactive can worsen RLS, but very strenuous exercise right before bed can also make it worse. Finding a moderate balance is key. Leave a comment if exercise helps you. Temperature. Some people find relief with a cold shower or a warm bath. Find what works for you. Magnesium. While scientific evidence isn't robust, magnesium is very commonly talked about. Whether through oral supplements, Epsom salts in a bath, topical rubs, or diet, magnesium might play a role. We always recommend getting nutrients from your diet whenever possible. How Paul got rid of his RLS. So, I had this forever, like decades, as long as I can remember. Then, about 5.5 years ago, Paul and his wife adopted a plant-based diet, and his restless legs seemed to disappear. I'm certainly not saying this is the cure. I'm not an anti-meat person saying, hey, do what I do. He acknowledges it worked for him, but probably won't work for everyone. Do you think it was some primal drive to go hunting in the middle of the night when you were a carnivore? Maybe, and then you were like, I don't need to hunt. No, I don't think so either. Did Elvis Presley have it? Michael Jackson? Maybe the moonwalk came from restless legs. We have Willis and Ekbom to thank for recognizing this condition. Not a lot is known about it, and it's likely underdiagnosed, despite being quite common and potentially very debilitating. So, if you're experiencing symptoms, you are not alone. Talk to your doctor. There are potential ways to help. Hopefully, this video encourages you to speak with a healthcare provider. If you think you might have RLS, get a diagnosis and start exploring treatment options. Now you know. If you like this video, please like it, subscribe to our channel, and remember, you are in charge of your own health. We'll see you next time.